Have you ever wondered why some babies seem to thrive from day one while others struggle with sleep, feeding, digestion, or development? Here's something that may surprise you. During your baby's first year of life, their brain will double in size and create more than 1 million neural connections every single second. Think about that for a moment. No other season of life will experience this much neurological growth and development. Yet, despite how important this time is, most parents are told to focus on one thing: milestones. Did they smile? Did they roll over? Did they sit up? Did they crawl? Did they walk? And if something feels off, most parents hear the same response: let's wait and see, or they'll grow out of it, or every baby develops differently. While those statements aren't always wrong, they often miss something incredibly important. What if your baby is technically hitting milestones while their nervous system is struggling underneath? What if the foundation isn't functioning the way it should? That's exactly what we're talking about today, because your baby's first year is about far more than checking boxes on a developmental chart. It's about building the neurological foundation for the rest of their life. One of the easiest ways to understand this is to think of your baby's nervous system as an air traffic control tower. Every function in the body has to pass through it: sleep, digestion, feeding, movement, immune function, sensory processing, emotional regulation, developmental milestones, everything. When the nervous system is organized and functioning properly, development tends to happen smoothly. But when stress enters the system, the body begins compensating. And that's where many families start noticing signs that something isn't quite right. At Vices Chiropractic here in Dallas, we often meet parents who tell us, I knew something was off. I just felt like nobody was listening. Everyone kept telling me to wait. We hear these stories every single week. Most parents think milestones are simply physical achievements, but they're actually neurological tests. For example, your baby's ability to latch and breastfeed requires precise coordination between the brain, cranial nerves, muscles, tongue, jaw, and digestive system. Head control around 8 to 12 weeks tells us how the brain and upper neck are developing together. The so-called 4-month sleep regression is often a period of significant neurological reorganization. And crawling may be one of the most neurologically important milestones of all. Crawling helps integrate the left and right sides of the brain. It develops coordination, balance, motor planning, visual processing, and even lays the groundwork for future learning and reading skills. That's why we pay attention not only to whether a baby crawls, but how they crawl. The sequence matters, the quality matters, the nervous system matters. One of the biggest concepts we teach families is called the perfect storm. The perfect storm is what happens when multiple stressors stack up on a developing nervous system. And for many children, it starts before they're even born. Maybe mom experienced significant stress during pregnancy. Maybe there was anxiety, illness, inflammation, or a difficult season of life. Then comes birth. While birth is beautiful and natural, it's also one of the most physically demanding events a baby will ever experience. Long labors, induction, Pitocin, vacuum extraction, forceps, C-sections, cord complications, large babies, fast deliveries, all of these can place a stress on a baby's head, neck, and nervous system. Then, after birth, additional challenges can continue piling on: sleep struggles, feeding difficulties, colic, reflux, constipation, ear infections, antibiotics, sensory overload, environmental stress. One stressor alone may not create a major issue, but when enough layers accumulate, the nervous system can become stuck in stress mode. And that's when we start seeing challenges with regulation, sleep and digestion, behavior and development. Understanding this isn't about blame, it's about helping parents finally understand why their child may be struggling. Here's the problem with the wait and see approach. Most developmental screenings are designed to determine whether a child falls within a broad range of normal, but they don't necessarily evaluate how efficiently the nervous system is functioning. A baby may technically pass a milestone screening while still compensating through tension patterns, asymmetrical movement, poor regulation, or developmental shortcuts. That's why parents often feel confused. They know something doesn't seem right, yet every test comes back normal. At Vices Chiropractic, we believe that parents should trust those instincts because early intervention is most effective during the period of greatest neuroplasticity, and that's the first year of life. This is where our approach is different. At Physis Chiropractic in Dallas, we focus on the nervous system first. Using advanced insight scans, we can objectively assess how your baby's nervous system is adapting to stress. These safe, gentle, non-invasive scans evaluate patterns related to nervous system regulation, muscle tension, stress adaptation, autonomic balance, and from there, we create a personalized care plan designed to support optimal neurological function. And when it comes to adjusting babies, parents are often surprised by how gentle it is. There's no twisting, no cracking, no forceful movements. The amount of pressure we use is often compared to checking the ripeness of a tomato. The goal isn't to force change. The goal is to help the nervous system regulate, heal, and develop the way it was designed to. Many families report improvements in things like sleep, feeding, digestion, colic symptoms, comfort and soothing, developmental progress, overall regulation, because when the nervous system works better, everything works better. Your baby's first year isn't just about learning how to sleep, eat, crawl, and walk. It's about building the neurological foundation that will support their health, learning, behavior, and development for years to come. So if you've been noticing challenges with feeding, sleep, digestion, sensory issues, tension, colic, reflux, or developmental milestones, trust your instincts. You don't have to wait and see. If you're looking for a neurologically focused pediatric chiropractor in Dallas, we would love to help. Schedule a consultation with our team at Physis Chiropractic, and we'll help you understand exactly what's going on with your child's nervous system and whether they're adapting to life the way they should be. Because the first year of life is too important to leave to chance.